Good day and welcome to the Christopher and Dana Reeve Foundation Using Mindfulness to Support Life After Paralysis conference call. This call is being recorded. At this time, I'd like to turn the conference over to Ms. Julie Lubinsky. Please go ahead. Ms. Lubinsky, please go ahead.
Hi, this is Julie Lubinsky. I am the Associate Director of Digital for the Christopher and Dana Reeve Foundation. I'd like to welcome you all to today's webinar. We're using a brand new platform for our webinars going forward. Just a couple notes. There is an audience chat function where when you type something in there, everybody can see it. There's also an Ask a Question button that will go directly to the presenter, so she can address that at some point in the presentation. And speaking of presenters, today we have with us is Terry Gupta. She's a Master of Social Work from Boston College. She's an internationally trained yoga professional. She co-founded Yoga Caps to bring free therapeutic yoga experiences to people experiencing chronic pain and mental health concerns. And we're so lucky to have her here again for the last in her self-care strategies webinar series. So now I'm going to turn it over to Terry. Hi, Terry.
Thank you, Julie, and welcome everyone to Mindfulness to Support Life After Paralysis. So as we get started today, I'd just like to make a note that we will be talking about our thoughts, our emotions in life after paralysis. So if at any time you feel discomfort, please give yourself permission to pause, to stop watching, or do something that feels safe and comfortable. As Julie mentioned, this is the last part of our self-care series. And Art of Managing Worry and Anxiety, the first webinar, and the second webinar, Mental Health and Self-Care for Caregivers, are both now on the Reeve Foundation's YouTube channel. So if you are interested to go back and take a look at those, we will refer to those here and there. However, today's presentation is a standalone, all on its own. Our content today, I'd like to say, is not intended to be a mindfulness instructor training. And it's also not to replace medical care or counseling. And if you are seeing a behavioral health professional, please do consult with them before applying any of the content. And we'll talk about that a little more later. And if you happen to be watching this at some point in the future via the Reeve Foundation's YouTube channel, please check for any updates on any of the information. Now, all three webinars in this series have focused on creating awareness, and that's awareness of our thoughts and our beliefs and the behaviors that result. In the first webinar on Art of Managing Worry and Anxiety, we asked ourselves the question, do we identify ourselves as worriers? Do we have a lot of worrisome thoughts? And we explored how this belief might have an impact on our behaviors. In the second webinar, we explored patterns that we developed early on in life. And this is things like worry and fear. It's actually where worry and anxiety may have had some of its roots. Also shame, worthiness may have had some roots there. And we did this to help explore some of these layers and how these early patterns might impact us now, and particularly on our self-care habits. So in both webinars, we discussed strategies to transform the worrier into seeing ourselves as I'm a warrior. And we touched upon mindfulness as a way to observe the changes in our lives. So today we're going to take this transformation a little bit further from worrier to more instances of being a warrior, and further into being a witnesser of our experience. And this can help us stay clear about who we are, what matters most to us, and also, and especially for today's presentation, to avoid getting fused with our experiences. So we are not our worries and we are not our other experiences. So warrior, a witnesser, this is just the way I am, and just the way I'm becoming, if that helps it feel more believable. And if you're watching this webinar, you are becoming more resilient. You are interested in becoming more mindful. And we all have that power to change. And we know that life with paralysis is changed, and it has a lot of changes. There's continuous change, and it calls upon us to consider change. So how do we begin to approach these changes? Well, Dr. Jack Kornfeld, who is a global expert on meditation, tells us, he offers to us that we're a river of change. And if we try to hold on, what we end up getting is rope burn. And it's a kind of recipe for suffering. Now, mindfulness tells us that we can watch the change and its effects from the perspective of the shore. We can let go of the rope and discover that we don't have to be swept up by the river of change, though it is often overwhelming. We can consider working with the change, and we can begin to honor or aim to honor the emotions, the grief, the loss, perhaps anger or fear, or other emotions that can accompany it. And we can use mindfulness to free us from the emotional storm and the emotional reactivity. And this takes our courage. Okay, so in effect, what we get to do today is watch our courage. Our session today hopes to deepen our understanding of mindfulness. And today we'll explore 3 ways we can use mindfulness to navigate the many changes in our daily lives. And our overall aim is to be responding in that place rather than reacting, judging, avoiding, or other actions. And we want to come out of being a victim of our thoughts. So we'll start today, as we have with the other webinars, with some questions for consideration. And the first question is about awareness. How much of our thinking tends to trigger our emotions? Now, this happens for all of us, and it happens throughout our life. But how aware of it are we? And do we have methods or strategies to support our emotions and our acceptance of life as it is? So I hope today you will develop at least some more mindfulness strategies or methods. And finally, then, the confidence in using those methods, right, and being more aware of and widening the space between react and respond. So wherever you are, if you've been a student of mindfulness for a while or if you're just getting started, these are some questions to think about, and we'll aim to have you get some benefit regardless of wherever you are in that journey. So let's begin with what is mindfulness. Our brain takes in a lot of sensory data. We're full to overflowing with sensory data. Everything we've seen, we've heard, we've experienced, places we've been, things we've read, et cetera, movies we've seen. So much sensory data as well as experience about our life, what's happening to us. And where we think about mindfulness, we can think about 5 different mind states. Is our state of mind a little flat or dull, somewhat depressed? Is it dissipated or feeling a little scattered from all of this sensory data? Is it oscillating? Does it go back and forth between having some times of focus and then some times of being scattered? Or is it maybe with the help of some strategies a little bit more focused or one-pointed? And then the state that we'll be talking about more today is that state of presence and expanded awareness. So all of this starts with paying attention and using our mental focus to observe. I'd like to say, though, when we think about mental focus, we're not talking here about trying real hard or strain. We're not talking about, squeezing the eyes to focus or gritting the teeth. When we practice mindfulness, and particularly if we start with short bits and then expand those sessions a little longer, it comes with a sense of ease. Okay, that mental focus just develops on its own. And the aim is awareness. And this is a state of being where our sensory data is confirmed by way of our observations. And mindfulness or awareness, sometimes it's 2 sides of the same coin, people believe, is just one part of a body of techniques that can help us to focus, that can help us to control or manage our attention. And and he adds, in the present moment, non-judgmentally, and in the service of self-understanding and wisdom. Now that's a mouthful, really. It's a long definition. But as you come to practice, if you choose to practice it, you'll see that each of those little phrases, and we'll talk about them some more, have some importance and some meaning to them. But another way to look at it is, if we have tendencies to live in our head a lot, mindfulness is presence of the heart. If we have tendencies to worry about the past or future, like we do when we live in our head, mindfulness brings us to the present moment. And in that moment is where we have the power to access resources that we may not realize we naturally have. And we talked about that in the previous webinars. We talked about having more resources, more talents, more gifts than we give ourselves credit for. So mindfulness helps us access that, these gifts of inner presence and the stillness that's there, and the wisdom that comes when we open that space. So we may not be able to change our situation, but through mindfulness we can be present to our experience and choose our responses to our situation. And we can experience that we're not the sensory data or the effects of that data that we're observing. We can experience our being nature. And the being nature that we have inside is the wise observer of our thinking, feeling, and doing nature. So Thich Nhat Hanh, another global leader in meditation and a peace activist, tells us, feelings come and go like clouds in a windy sky. So that's something to really think about and consider, and actually might even have a mindfulness session by watching the clouds, thinking about this. And developing that idea even further, Pema Chodron, another global mindfulness leader and meditation expert, says, you are the sky. Everything else is just the weather. So another point there that we can really ponder. So mindfulness asks us this: can we see ourselves as the unchanging sky? Can we watch the weather, both the storm clouds and the sunny days, without fusing with them, without attaching or identifying with them? We have experiences, but we are not our experiences. We're not the roles we play or the conditions we may live with. Mindfulness sees the self as whole and complete. I'll repeat that. Mindfulness sees our inner self as whole and complete. And we find that in our wise inner space. So as we look to get started with practicing mindfulness, there are some things to think about. You know, it is advisable to begin with sessions of mindfulness with a little bit of movement, simple range of motion, some stretching maybe, and this might be actively that we do on our own. It might be assisted if there are parts of our body that aren't moving, and it might be mentally done. It might be visualized, again, if there are for the parts of the body that don't have movement. And you can see then that it can be naturally included or incorporated into seated exercise, into physical therapy, into occupational therapy. It's naturally a part of yoga, so yoga always includes mindfulness and meditative types of practices. But this movement that comes from the exercise, the yoga, the therapeutic movement, helps us create some ease in the body. And research also connects breath with our experience of emotion. So this leads us to our first technique, and that is body and breath awareness, and these become our anchor. So this first technique of mindfulness is body-based and breath-based. So what this means is that we focus our attention, we pay attention to the body, perhaps to the cycles of breath as part of the body, or any other sensory data that we have readily available to us. And we just watch this, maybe with some curiosity, looking maybe for concrete details. And there are many present moment experiences that we can focus upon. I mean, we talked about just a moment ago looking at the clouds, right, or watching the sky. But our own experience, our own body gives us a number, and I have some listed if you are tuning in and watching on your computer as well. So we might, for instance, watch the path of the breath. And we talked about this. We offered a number of ways we can watch the breath in the webinar, the first webinar on managing worry and anxiety. So we might watch the inhale. We might take a look at the exhale. We look at the flow. We look at the pace. We look at, is it a smooth breath? Feels like it's getting caught anywhere? We might watch for the space where the inhaled breath transitions to the exhaled breath. We might listen to sounds from outside of the room or the building we're in, and placing ourselves right in the middle of those sounds, like a radar screen. And each sound is a blip on that screen. So here we're not analyzing, we're just looking for those blips. There's a sound, there's another sound. And even the body sometimes cooperates with a sound, maybe even the sound of our breath. Another way we can have a present moment experience of mindfulness is maybe the touch of air across our forehead or at the nose tip. Maybe it's warm air, maybe it's cold air, depending on where we live or if we're using heating or cooling. Sensations and other qualities of the sensations at the nostrils, inside the nostrils, following the breath, or other parts of the body. And we can perform what's called a body scan, and that can be of the full body, an outline of the body, or it can be a partial body scan. And I'd like to, it may take us add a little more time to our session today, but I'd like to do a short body scan just to give you an idea, and we'll just do a partial one. We'll just do the hand. So if you can determine, even though this is a short, simple attention exercise, if you feel it's safe for you to participate in a mindfulness exercise right now. So if you're listening out in public or driving, or for whatever reason, if you feel it's best not to engage right now, maybe you can listen to the recorded version of this exercise at a more convenient time. But assuming you are in a safe place, check to make sure that your chair is secure for you to practice. And take a moment maybe to make any adjustments to that, make any adjustments to your posture, a nice upright posture if possible, to your clothing, and see about bringing awareness to the whole body. All the parts, all together as one. And consider if you'd like to close your eyes, or if you prefer, you might form a soft gaze, perhaps to your cheekbones. And thinking about the eyes, see about softening them if that feels right to you, whether they're open or closed. See about softening the muscles around the eyes, noticing also the eyelids and softening there, the cheeks, the jaw, and softening through the jaw. And consider some softening physically, or mentally imagine softening through the shoulders, down through the arms, the hands, into the trunk and hips, and down through the legs and feet. Just creating a sense of the whole body, some comfort, some ease, whatever that means for you in this moment, safe and with some ease. Seeing now about the breath and noticing the breath without any manipulation to it. Just finding the next inhale and following it. Following it to the exhale. And following that. Following each part of the breath. And while you're doing this, also make a resolve to stay awake, to stay alert, secure in your chair. And throughout this experience, giving yourself time to perform any pressure relief needed, and then coming right back to the practice. So shifting awareness now to the hands, both supported, perhaps in the lap. And if it seems right to you, place the right hand with palm facing upwards and the other with the palm facing downward. And focusing then on the fingers of the right hand, and in particular, the right hand thumb. And you can even mentally repeat right hand thumb. Perhaps there's some softening there, perhaps some ease. No effort is needed physically or mentally. Just noticing, watching to see if there's any softening, or mentally imagine what softening might feel like, even in this minutest experience. Moving on then to the second finger, mentally repeating second finger. Third finger, fourth finger, fifth finger. See about bringing attention to the whole hand and to this palm that is facing upwards. If it feels right, mentally begin scanning the terrain of the palm, noticing any sensations, seeing what's right there, just like a scanner, going across the uneven terrain of the palm, scanning the palm for sensation. If thoughts come, gently remind yourself about the scanning and return to the contour of the palm. And now seeking the back of the hand, mentally scanning the back of the hand for sensation. And noticing the terrain there. Some parts that are more level, and some parts that create the hills and valleys of the knuckles. So following with the scanning now into the fingers, through the length of the fingers. One sweep maybe to the tips of the fingers, sensation in the tips of the fingers. And sensations now throughout the whole hand, all at once, all of the parts of the hand all together, the whole hand. You might consider the experience of the opposite hand now, the one with the palm facing downwards. Noticing each hand, the similarities, the differences. And in the interest of time, bringing awareness now back to the whole body, all the parts together as one, the whole body. This short experience is over. And consider opening the eyes if you have closed them, and make any movements that you might find helpful. So while you're doing that, I'll ask a couple of questions. Did you feel that your attention was watching the hand and fingers? Did the attention feel steady? Did the attention jump around with other thoughts or judgments? And this could be judgments about the hand or about the experience itself. In any case, did you see that you were both the observer and the observed? So this is a hallmark of mindfulness. And we went a little quickly in that exercise, okay, and that's in the interest of time for our session today. But, when you do this on your own, you can take more pauses. And the thing about this first part, this body and breath-based awareness, and this body scan in particular, is that this type of experience takes us from the prefrontal cortex into the somatosensory cortex, and perhaps even into the motor cortex, depending on how we do it. You may recall this graphic, this slide that had the same graphic from the Managing Worry and Anxiety PowerPoint that we used. And it tells us that we do have some control over the sensory volume dial in the brain, the messages that get sent from the thalamus. And the thalamus sends these messages, this sensory data, to the amygdala and the cortex. The messages travel at the same time. However, they get to the amygdala quicker. It's closer, and also the amygdala is where we react. It's our fight, flight, freeze. It's our alert center. And in the cortex, our logic center, it takes just a couple of seconds more possibly to process, to think, to evaluate that sensory data. It needs to connect to other parts of the brain to interpret. And when we focus like we did in our real illustration, our short practice, when we focus on certain body areas, we use the mind to regulate the alpha waves coming from the thalamus. And when we don't focus, when we're not mindful, we're more likely to be flooded by the competing data and the corresponding sensations. So this has implications, as you can imagine, for pain, for stress, for worrisome thoughts. These are all places where we might not be responding in real time. We might be in the past or in the future. And this initial type of mindfulness, body and breath awareness, that focuses in this way helps us to stay more flexible in our response so we can really modulate that dial of our sensory volume in the brain. So when thoughts come, and they will, and possibly they did in our short exercise, we can simply redirect our attention back to the present moment watching. So if you notice, that gentle redirection might take the form of one word, scanning. You know, we said if thoughts come, just say to yourself mentally scanning, and not saying a lot of words because we're not wanting to overload, again, that sensory data. If we're thinking, if we're worrying, if we're judging or comparing to how this hand functioned at another time, we just come back to scanning, or just the breath, whatever it is we're doing at that moment. That's body and breath-based awareness-based. So we start in small increments of practice time, maybe even 1 minute, and build from there. You know, it sounds simple, and it is. It becomes very interesting to do, but you'd be surprised, or maybe not, from your experience, how many thoughts we get or how many judgments come up. Judgments we have a habit of forming these, and most often we're the target of our judging. So these small increments then, research indicates that even those new to mindfulness can experience helpful results. And all of this helps us develop skill in modulating the sensory volume dial in the brain and prepare us for additional ways of practicing mindfulness. So we use this way number one, this technique number one, as an anchor. As if this is the only technique we were to use, this is a powerful one. And this one will help us accomplish the objectives that we set out to for today. But there are some of you that may have been practicing this already. So maybe you'd like to know how to do another way. So the second way we're going to talk about today is body and breath-based mindfulness in our daily routines. So taking this ability to keep our focus exclusively on our body and breath and bring it to our daily care routines or other activities. So an example here might be brushing our teeth. So how many times we've brushed our teeth and we have lots of thoughts coming, lots of judgments maybe coming about the way we need to brush our teeth or how we used to brush our teeth. But can we focus on the feeling of the brush against the teeth, the sensation of toothpaste, the taste of the toothpaste, the water as we swish the suds around and spit it out? Can we keep it body-based? So we'll work on thoughts and emotions in our third way, but right now we're keeping it body-based, breath-based with our daily life, okay, our daily care routines. And perhaps in life before paralysis, many of our daily activities were on autopilot. But in life after paralysis, we likely have become really good at watching our daily routines, our daily experience. We've scrutinized it perhaps, and it perhaps still have resistance to some parts of it, and that's normal. And being aware of that resistance is helpful, which mindfulness helps us build. Our routines, the new routines, have needed to be learned, and perhaps with multiple adaptive tools, all new ways. We've been coached, we've been questioned by the doctors, the nurses, the physical therapists, occupational therapists, other health professionals, therapeutic recreation supports, caregivers. We've been questioned about all of these. And we've had to describe feeling, function, pain, other sensations. And perhaps we continue to discern that the new ways that our bodies communicate with us. So we've learned to watch carefully for so many things. And that gives us a really good start for mindfulness. We've already likely developed attention and levels of awareness. What we add when we practice this mindfulness is the way we're watching. So Jon Kabat-Zinn, who we mentioned before, describes these attitudes that you see listed now as helpful for mindfulness practice. And I'll say before we start, it's kind of a long list, and there's definitely some overlap. And some pieces may resonate right away, and others that you may feel some resistance to, and that's okay. You can just observe that. The first one is non-judging. Dr. Kabat-Zinn tells us every action has thoughts, emotions, and other behaviors associated with it. And this is, when we're non-judging, this is the observing of experience without getting caught up in those thoughts, in those emotions, the likes, the dislikes, the good, the bad, the labeling. So that's non-judging. Patience is accepting that things will unfold in their own time, and having a sense of beginner's mind like we've had to have, being willing to see things as if for the first time, and maybe revisiting that beginner's mind with each task. Innovation lives in beginner's mind, and perhaps you've discovered that already. Trust in our own wisdom. We're surrounded by medical experts, and that's a good thing. It's been critical, and it's been an important function. But trust asks us to speak up with our perspective, with our experience. Non-striving is holding our experience in simple awareness, and without doing anything with it, just holding it with that awareness, maybe with some gentleness as well. Acceptance, then, is seeing where we're resisting, avoiding, maybe denying, and seeing those things as they are, not as they used to be or as we wish they were, and letting go. And by that we mean letting things be without trying to hold on to or reject parts of our experience. So as I said, it's a longish list. It's a lot of powerful things, and can be overwhelming if we think about them all at once. So perhaps, start by considering one or two, thinking about it a little bit, and then maybe by finding some ways to apply them. So that's our second way. Moving on now to our third way for those who feel that they'd like to, explore this area a little bit. This is bringing mindfulness to our thoughts, to our feelings, and perhaps to our behaviors. So in this third way, we have three lenses that we're going to look through. And there are three boxes there. One for RAIN, the acronym RAIN, which stands for Recognize, Acknowledge, Inquiry, Non-Identification. The second one for Stop or Pause and Take a Breath, Observe, Proceed. And the third one for SEAT, Senses, Emotions, Actions, and Thoughts. Okay, so this first way, RAIN, is based on a lot of the mindfulness body of knowledge and research. It's used quite a lot by Dr. Tara Brach and so many others in the mindfulness field. And perhaps Michelle McDonald is the person who coined the acronym there. Stop, very similar, so Stop may resonate more than RAIN. You'll have to see about that. And SEAT comes from Dr. Christopher Willard of the Harvard Medical School faculty. So these three ways have some similarity, but there may be one that resonates more than the other. And what they have in common is that they use active incorporation of our thoughts and emotions that arise. And these may arise in our mindfulness practice. They may arise through our daily life. They come up, and here's where it could get a little more challenging, right? We created our anchor in that first experience, that first way of applying mindfulness by observing body and breath. And that's what gives us our baseline. Again, our anchoring is a good word to help us be able to look at these emotions, these thoughts. And we experimented with applying that to our bodily experience. Can we stay mindful in our daily routine without the thoughts and the experiences and the judgments coming up? And then if we have some confidence, then maybe we can just start to look at bring their attention to the thoughts and the feelings and the experiences. So relying and building upon from the previous applications. So another thing we can do if we want is consider the tense of the wording. So if we look at the acronym RAIN, the first initial R is for recognize. And if recognize doesn't quite feel right to us, maybe it sounds a little commanding, there's not enough choice there, or we're not believing that we can recognize, can we say the word recognizing and see if that makes a difference? And often people report that it does. So you can experiment with that. And like the two previous ways of being mindful or using mindfulness, this third way holds a space, and it also allows the natural wisdom to emerge and the caution to stop any time and return to a place of ease, especially when we are looking at this third way. So let's begin. Let's look at RAIN. Let's look at what do we do with RAIN. The R stands, as we said, for recognize. And here we're just seeing what's there. We're observing the presence of emotion, physical symptom, a thought pattern. With A for allowing or affirming or acknowledging, there are a lot of A words there, we're seeing that it is there, whatever it is, the emotion, the symptom, the thought pattern. And we are raising awareness also of emotional resisting, that place where we say, I don't want this experience. It's a natural response, and also denying, versus radical acceptance, okay? A gentle allowing. And physically we may also avoid. And allowing is an opportunity to reconnect with all the parts of our body. Allowing is, and we can say, where do we feel it? That symptom, that emotion, that thought, where in the body? And allowing is often found in the space between a thought and an emotion, and between an emotion and behavior, because our thoughts produce emotions that lead to our behaviors. And then once we've recognized and acknowledged or allowed, we can start to bring some inquiry. And maybe it's to that place in the body. We bring inquiry, we bring some kindness, we soften with breath. So we might notice then that we can approach it a little better, as opposed to resisting, which intensifies it. We might notice that it has a rise and fall. It may come and go. We can look at where it stops and starts, and the space in between there. And we're also watching here, we're bringing any inquiry into our self-chastisements that might arise about our thoughts or our feelings. And throughout it all, exploring with tenderness what comes from the allowing and the accepting. And again, the judgment. We mentioned that earlier as one of the attitudes to cultivate. So just the idea that we are not this experience. Sometimes we look from our experience, from the experience of worry, from the experience of pain, from the experience of judgment. And here can we be looking at our experience as opposed to from our experience, not fusing or attaching ourselves to our suffering. Can we recognize that judgment is simply a habit we formed maybe? And can we remind ourselves to hold ourselves with care? So that's our RAIN technique, and there's lots more you can read about that if you'd like to. The stop technique just is a reminder during the day to pause. And in that pause, we just do a little check-in, taking a breath to calm before we do anything else. In RAIN, we're kind of exploring a little bit and using the breath to soothe, to guide, to soften. In stop, we're immediately taking a breath. We're observing what's there, the thoughts, the feelings, the emotions, again, without analysis, without judgment. And we do that for a period of time, and then we decide to proceed when we feel ready, and we do something that feels supportive. So stop is something we can use anytime throughout our day. In the anxiety webinar, we talked about using stop for worry sessions. So a worry session is where you schedule, maybe 5 minutes, maybe 1 minute to put all your worries from the day there so that you're not worrying throughout the day. So you may need to time limit your observation here, depending on if you are someone that experiences anxiety. And say to yourself, okay, this session is over now, and I'm going to proceed to something that feels supportive to me. And whatever that may be, it may be getting online and tuning into Reeve Connect, the online support area. It may be doing something from our second webinar on mental health that's related to self-compassion. So it might be an inner smile that brings self-calm. It might be a self-hug, all the research that we talked about on self-compassion and our own embrace, breathing into a hug. Maybe it's even just the hands in the lap or the hands around the lower extremities or the lower parts of the arms, rather. So proceeding to something that feels supportive. So that's our stop technique. And then CIAYT looks at, and this one's a little bit different than the other two, what are our senses telling us? So it's diving right into naming the emotion and acknowledging what it is. What are the actions I could take right now, right in this moment? What's my choice? And would this action be helpful? Would it be unhelpful, or would it be neutral? And then thoughts about it. Are there self-judgments going on about past actions? Are there self-judgments going on about the emotion itself? And then we resolve to start again. So that is our SEAT or CIAYT technique. And again, a little bit different than the other two. So that's 3 lenses that we can apply that third way of looking at feelings, thoughts, emotions, and behaviors. So shifting then into some guidelines, some practice guidelines. And here we want to talk about safety as well as overall guidelines. So when we're practicing, particularly, sitting and not doing mindfulness, kind of in the waking world or in the course of our daily activities, if we're, sitting for a mindfulness session, we want to make sure that we feel safe, that we feel there's some positive and supportive containment there, that the space is hygienic, maybe as free as possible from clutter. The air feels comfortable for breathing, etc. We want to look at a comfortable, stable, seated posture, a sturdy chair with arms. I know sometimes we may take the arms off of our chairs, or we may lower the arms, and that may help us in navigating. We may take the brake off or not use a belt, all of these things. So alignment support. So these are ways that maybe we can be stable and comfortable in our seated posture, particularly with sleepiness, because there may be some sleepiness before. Maybe we didn't get enough sleep. Maybe that's why we're wanting to do some mindfulness, to just bring us into more presence. Maybe during the exercise we will feel sleepy, and sometimes when we stop and pause and focus like this is when we realize how tired maybe we really are. And maybe we start to feel comfortable for the first moment in the day, and we may nod off then and get the sleep that we really need. So again, stable and sturdy chair. And then after, making sure that we are awake and alert to go on to the next parts of the day. And pressure relief and any other adjustments as needed during the technique, these can be incorporated mindfully. We talked already about building our experience and our skills gradually. So if we can, if we're doing that first way, the body and breath-based mindfulness, can we practice at the same time in the same space? If we can, it's helpful because it can support our neural circuitry. I mean, it'll support the neural circuitry regardless, but if we can use the same time, the same space, it'll maximize that a little bit more. And then when we do our daily routines more mindfully, that again reinforces and supports a neural circuitry towards awareness. And then we consider applying that to the thoughts and feelings, initially to see what those are in a given moment, and then with confidence to practice when we're under some duress. Okay? More guidelines, more safety cautions would be if you're planning to, or if you are using apps or other tools, really all we need is our own self to practice mindfulness, but if you're using other tools, really consider researching them or checking the research they've done. See what some of the effectiveness ratings are and what people have to say about it, and particularly about the claims they're making. Mindfulness has become such a catch-all for curing things, okay? So, we want to approach realistically that this isn't about curing or fixing or anything. We don't need any of that. We just really want to explore and examine the self and who we are inside. We said in the beginning that if you are seeing a behavioral health professional or have some significant mental health concerns, please talk with a counselor first to customize the practice according to your needs. Okay? Talking here about things like panic disorder, major depression disorder, okay, as opposed to mild anxiety or mild depression. It's helpful to have someone who understands challenging experiences or unpleasant experiences because some of these could arise. We're talking about the mind. We're talking about our thoughts. We're talking about our emotions. So here is where building a strong anchor, a strong base for practicing mindfulness will help, that you yourself can help lead yourself through some of this, but there may be some times when a counselor or someone who understands these can be helpful. And there are also many other types of meditative practices besides mindfulness, besides the 3 ways we talked about today, that may feel more appropriate, or you may want to learn these and explore these. And remembering, finally, that a medical emergency needs quick action. So we can use our base of mindfulness practice to stay calm as possible when we respond, but the focus is on responding appropriately and quickly. Okay? So looking now to the effectiveness, we mentioned that it's a good thing to check. So in general, the type of mindfulness that we've talked about so far today, we're going to look now at a list of things that mindfulness can be helpful for. And as we look at these, let me say that if we looked at all of the studies, it would be a much longer list. It would probably be more than a full slide of lists if we tried to fit them all on in several columns. And actually we've done that, and it does take numerous columns, all of these studies. But what we're looking at here are the reviews of studies, the meta-analysis. And what it's indicating to us is that mindfulness can be helpful in aging and memory and a lot of biological effects. So if we look at the brain, for instance, mindfulness can increase the cortical thickness in the prefrontal regions. It can create some difference. It can increase brain volume in actually 4 regions related to things like mind wandering, memory, emotional regulation, perspective taking. It can help with building empathy and self-compassion, which is, we talked about as a protective factor. It can help with neurotransmitter production and many, many more things that these 4 regions are related to, that where the brain volume is boosted, it becomes more robust, more resilient. And interestingly, studies indicate that it can also help decrease the size of the amygdala, the place where fight, flight, and freeze come from. So anxiety, stress, and fear in those areas, so we can modulate it a little bit better. So it can help us, if we look at telomerase, right, it can help us rebuild, restore the ends of the DNA. It can help with immune function, with inflammation. If we look at conditions like cancer, it can help with the side effects and some of the side effects of the medications, fatigue, gastrointestinal disorders. It can help modulate eating behaviors. It can help, as we mentioned earlier, with mental health, and we'll talk on the next slide a little bit more about that. It can help us modulate pain in terms of intensity and relief. And it has a lot of school-based research where mindfulness has been used to support young children all the way through college age. So there's a good body of knowledge on that and some foundations actually that support that. And some of the colleges and universities and secondary schools really use a lot of this emotional and social learning in their curriculums now. It can also be helpful in recovery, so with substance misuse, and particularly if we look at managing cravings, reducing them, if it can help support tapering, and also with withdrawal symptoms, as well as self-regulation, which I've left for the final word on effectiveness, because this is really, I feel, a very powerful area where self-regulation is where we can modulate our thoughts, our emotions, our beliefs, and our behaviors. So emotions, according to theorists in the field, have three basic motivations: approach, avoidance, and attack. So what that means is there are some things we want more of, and these might be things like enjoying, learning, loving, protecting. There might be some things we want less of, feeling isolated, rejected, dismissed. And then there are some experiences or some emotions where we feel devalued. There's an attack there. There's shaming, blaming, and criticizing. And as we said earlier, most often we're our own target of that, which mindfulness helps with that. And mindfulness actually helps with all three of these because we're looking to achieve balance in our emotions. Feelings that are amplified may lead us to compulsions, to addictions. And mindfulness helps modulate these to support choices that are in our best interest. And we mentioned the school-based interventions, and now we'll look at interventions in healthcare, and particularly behavioral healthcare. So mindfulness-based stress reduction, MBSR, perhaps you've heard of, and we mentioned John Kabat-Zinn a couple of times. So he and Dr. Saki Sanchirelli had started this out of the University of Massachusetts, and so that's used in healthcare. Another one is mindfulness cognitive behavioral therapy, and this one, if you know about cognitive behavioral therapy, there are a lot of similarities. They're very complementary with each other, and applying that then further into depression. And here's where those of us with the experience of major depressive disorder or depressive relapse, the studies show, can get some real support. So integrating it into, the behavioral health care. Mindfulness-based relapse prevention is another area, used in the recovery field. And more cutting-edge application is compassion therapy, mindfulness-based compassion therapy. And we talked about that more in the mental health webinar, so you can perhaps take a look at that. So if we were to start to bring some summary to our webinar today and all three webinars in this series, we focused upon the gradual development of awareness. And we can look at it perhaps as layers, maybe 4 layers or stages, although it's not a linear process. Okay, but it's helpful maybe to look at it as 1, 2, 3, and 4. So in paying attention, which is what we started our talk with today, about paying attention, we start to see what's happening. And this leads us to a beginning awareness. So we're paying attention to our self-talk, that inner critic, and the thoughts that we have, those inner thoughts, the emotions that come from that self-talk, the behaviors, perhaps the patterns that we explored in the second webinar that are rooted in our early experiences, and ways that our thoughts and emotions hijack us, and places that disagreement feels like a threat to us. So that's our first layer. The second layer then moves from beginning awareness to developing awareness. And here's where we support our experimentation with separating ourselves from the stories we tell ourselves, from the patterns we repeat. And here we see the triggers. We're using techniques aimed at responding to them, but there's still some tendency maybe to react. And we start to understand intellectually that we're not our thoughts, our emotions, or any experiences or conditions of our bodies. So, we may, with any experience or condition, we may be at different places in different times. We may have a good sense of mastery over one, but still in the beginning stages of another. So these are our first two layers. A third layer is where awareness becomes more established, and we gravitate towards the witnessing, towards the observing. We see the triggers, our confidence grows in responding rather than reacting. The inner critic is still there. It's still giving us the self-talk messages. Its job is to protect us, so we want it there, but we want to be able to modulate it so it doesn't drive our choices. And here's where we can start to change maybe our thoughts and behavior patterns. And from an intellectual understanding, we now have a felt or embodied understanding. We can experience that we aren't our thoughts or emotions or conditions or experience of our bodies. And more in the fourth layer, we gain mastery and become rooted in self-awareness, who we are on the inside. And this, as Maya Angelou talks about, is a new day. And I have never seen this one before. It gives us the gift of presence, a new day. And in this moment where we're in this webinar, while it's being recorded, we're just early into 2020. So a new day and a new year. But mindfulness brings that presence every day, every year. It's new. Every moment it's new. And presence helps us build resilient mental health. And we talked about resilient mental health, 4 of the factors. There are many, but we focused on 4 in the second webinar on mental health. So presence helps nurture our sense of safety and security. It fosters our discovery of who we are and helps us form and come to an authentic relationship with ourself. It brings clarity to our choices about mastery of what matters most in our lives. And it enhances our connectedness and our common humanity. We can feel when we hold ourselves and others with care and presence. And mostly, we want to be accepted for who we are as we are. Can we give ourselves that gift? It takes some practice to cultivate presence, but it opens us up to the vast capacity we have inside. After all, you are the sky. Everything else is just the weather. So for additional support, we can turn to that YouTube channel, and the address is there for it, the web address, and Julie also has placed that in the audience chat, so you can just copy it there and cut and paste it into your browser. You can see the art of managing worry and anxiety, mental health, and self-care for caregivers. And our webinar today, which is just about completed now, will be posted there. Julie, will it be a couple of weeks, or will folks get an email?
Folks will get an email with the link to the recording on our YouTube channel, and I should have that done by the end of the week.
Terrific. That's terrific. Okay, so you'll get that email in your inbox, whatever it is that you registered with. For additional support, you can also consider exploration of the counseling approaches we talked about, those MBIs, mindfulness-based interventions. And you can also, if you haven't in a while, visit the ChristopherReeve.org website. You know, when we talked earlier about transforming from worrier to warrior to witnesser, and we said we have the resilience, we can build the resilience, and that's what the series has been all about, building resilience. So we may have thought about it as an individual thing to do, But how do we do that? Where do we go for that? How do we access that? We visit a resilience community, such as the Reeve Foundation. And there are so many resources there. And if you're not finding what you're looking for, you can call, email, text the information specialists, and they can be a support. So there are experts, there are peer mentors. You can be a peer mentor. There's Reeve Connect that we mentioned in the other webinars and briefly today. You can read the blogs. We will have actually another blog coming up on mindfulness that offers a check-in. And in that blog, we're going to focus on some of the common challenges that some folks have experienced, so sort of like a troubleshooting guide once you get to practice a little bit more. There's research. If you want to learn about the research trials, you can make some inquiries, quality of life grants, and events. And events are an opportunity to interact with the Reeve Foundation professionals in person, which is a nice thing. So we began with some questions. We'll briefly revisit those questions. So how much of our thinking tends to trigger emotions? So this is an awareness question. So hoping that, you've thought a little bit about that and, awareness of what is it that causes us to react. Maybe we can keep our awareness on that. What are those things that can do that? Then our strategies. What are the methods that can support our emotions and our acceptance of life as it is? So we presented a number of methods throughout all 3 webinars to support ourselves, to support our lives, our daily routines, and what is our confidence level in being more aware of and widening the space between react and respond. So hopefully, my sincere hope is really that this has been just the right support, either for you to get started, if it's new information, or to be helpful in building your confidence in what you already know. And we find that, as we talked about, in the place of presence, the place of wisdom inside. And I'd like to suggest, as a, kind of parting thought before we look for questions, is that we not practice this for self-improvement or because someone said, oh, this will be good for you or anything like that, but rather we do it for self-discovery, for learning and coming to a relationship with ourself. So that's what I have for you today, and I've enjoyed being with you in this series, whether you've tuned in just for today or whether you've participated in all 3. And we are, as I thought we might be, just a little bit over, but we do have some questions. So the first question is, can mindfulness help with pain? How can it help with pain? So the answer is yes. Mindfulness can help with handling pain, managing pain. And I love how you framed your question. You said, can it help with handling pain? So it may not make the pain go away. It might, but it may give you the tools to move into where is it pain? What is the experience? Where does it soften? Where does it begin, this pain? Where does it end? Does it have an ebb and flow? Often we resist pain, and when we resist pain, the body sort of tightens up, and what we resist persists. And the pain signal then gets wired in our neural circuitry. So mindfulness can help us possibly with exploring that with tenderness, exploring that with our breath, and really coming to a new relationship with that pain. So there's more reading that you can do on that, and please know that that is one of the areas of the meta studies, the meta-analysis, and I wish you best with exploring that as you do that. What I would suggest, though, is that you really start with anchoring yourself with that first method, okay? So that is one question. Let's see if we have any other questions here. Please do feel free if you wanted to do an audience chat and post your question publicly, or if you wanted to type your question into the question box, you can do that. The Ask a Question button will only be seen by me, so feel free to type something in. Maybe we'll take a minute and see if anyone is doing that. While we're doing that, I have another thing to just think about. This comes from Dr. Tara Brach. She says, when we ask our heart what matters most, we're already on the path to presence. So something to think about, moving from being in our head a lot to being in our heart. And the technique that we used for that in the second webinar was really shifting awareness. When we get kind of in that space to practice mindfulness and bringing our awareness to the center of the chest and just focusing there and breathing with our attention there. So that can be something. We had another question that just popped up about where will this be published? It'll be published on the Reeve Foundation's YouTube channel, and Julie has posted that link in the audience chat so that you can see it there. And Julie reminded us that we will also get an email inviting you to the YouTube channel to view that webinar. And while we're there, you may explore a little bit for other webinars that are there. Okay. So we have a comment that this is my first time tuning in. Well, welcome. That's wonderful. We hope it's your first of many times tuning in, and I absolutely loved it. That's great. This is the work of many people in the field, and it's also your own experience of your own self. So yeah, it is something to love. And I just want to be able to reference this whenever it's possible. Terrific. That is great. So, I wish you lots of good interactions with folks, and again, building your own resilience communities, and maybe adding your input and your understanding of mindfulness as you start to practice it on Reeve Connect and in other opportunities in your life. So I'm looking at our chat box, and it looks like we are clear there. And also, Julie, I'm not seeing any new questions. Are you aware of any that maybe I'm not seeing?
Nope, we're good.
Okay, well, I'd like to thank Julie, and I'd like to thank the Reeve Foundation and each of you for taking the time to tune in, whether it was just for today or whether it was for other parts of the series, and send my good wishes to each and every one. Thank you.
This concludes today's webinar. Thank you for your participation. You may now disconnect.